You are expecting, and we deliver the best care here at CHRISTUS St. Elizabeth Hospital. We invite and welcome you to take a tour of the third floor and become familiar with the mother-baby units. Along the way, you will meet some of the wonderful nurses who will be caring for you and your baby. Our team will be a support system to make your birth experience all that you have dreamed and will individualize your care to meet your own personal goals. Please make sure to register online as a prenatal patient if you are delivering at St. Elizabeth at www.christushealth.org. Center for New Life, Triage. All OB patients will report to the Center for New Life on the third floor and will go to Triage, where you and your baby will be evaluated. The Triage assessment consists of the following: 1. Changing into a hospital gown. 2. Giving a urine sample. 3. Being placed on a monitor that will check your baby's heart rate and contraction status. 4. Obtaining vital signs. 5. Detailed health history of your pregnancy. And 6. Vaginal examination to check if you are dilated, if deemed medically necessary. If your bag of water is broken, you will be admitted and will remain in the hospital until you deliver. Pay attention to the color, odor, amount, and time your water breaks. It is easy to remember the acronym COAT regarding your water breaking. Our two most common questions from expecting mothers are, when do I go to the hospital? And how do I know if I am in real labor? You will need to report to this same third floor triage if you are having regular contractions that are getting stronger every 5 minutes, lasting 1 minute over 1 hour. We call this the 5-1-1 rule. You live far away or have a history of rapid delivery. Report to the hospital once your contractions become more regular. Your water breaks and you are leaking fluids. You have vaginal bleeding that is more than a period. Your baby is not moving. You are having severe abdominal pain that will not go away. You have fever greater than 100.4 degrees. You are having signs and symptoms of a urinary tract infection, including burning with urination, urinary frequency, decreased urine output, bladder pain, and bladder spasms. You are having any other concerns you feel are urgent, or if something simply does not seem right.
Hi, my name is Fallon Anderson. I am a registered nurse here on the Center for New Life. I have worked at CHRISTUS St. Elizabeth since 2011. I am also a registered respiratory therapist and certified breastfeeding counselor. Well, here on the Center for Life, every labor process is different. We try to cater to our patients' unique needs here on the center. We try to get to know you. We practically become part of your family through this experience.
Hi, my name is Melissa McIntosh. I'm a labor and delivery nurse here at CHRISTUS St. Elizabeth. I am a certified obstetric nurse and also a certified breastfeeding counselor. The Center for New Life is where we labor, deliver, and recover all of our moms who are giving birth. All of that happens in the same room. Here on labor and delivery, we almost always have a labor in progress. Nurse-patient ratio tries to be 1-to-1, so your labor nurse is your labor nurse.
Right after delivery, we place baby skin to skin with mom. It's very important for mom to be able to bond with the baby. I'm ecstatic to be a part of their experience. I want to give them much more. I want to exceed the expectation. Here we want them to remember what that experience was like and to want to do it again.
I can genuinely say I love my job. Every day is something new, but you don't bring babies into the world very often. And I love to be a part of that experience for every new family and new moms.
Labor and delivery. Once your physician admits you for labor, your nurse will take you to a private room on the Center for New Life and will obtain lab work, start your IV, and have you sign consent forms. Your nurse will provide one-to-one care once you are in active labor and are dilated approximately 5 to 6 centimeters, with contractions occurring regularly. Your nurse will remain with you throughout the labor process and will continually check your infant's heart rate, uterine contractions, your vital signs, your cervix for dilation, effacement, and station commonly known as the cervix opening up, thinning out, and the baby moving further down into the pelvis opening. Pain management and comfort techniques are provided based on your personal preference and request. Some moms want to control pain during labor with breathing, frequent position changes, jacuzzi baths, imagery, and visualization. Other patients prefer IV pain management and/or epidural anesthesia. Most laboring patients tend to perform a variety of comfort techniques, and the key is to do what works best for you. Please include your OB/GYN in your pain management plan. Your nurse will coach you through pushing once you are completely dilated at 10 centimeters. As soon as possible, after a normal vaginal delivery, your infant will be placed skin to skin with you and start breastfeeding as soon as hunger cues begin. This time is known as the golden hour, where you and your baby may bond and get to know one another better. The nurses will protect and encourage this once-in-a-lifetime moment for all families, regardless of feeding preference. Research has shown babies who are placed skin to skin right after birth and remain with mom uninterrupted for at least 1 hour have better breastfeeding outcomes, and their vital signs and blood sugars stabilize faster. 2 identification bracelets will be placed on your newborn soon after delivery, and you and your support person will receive a matching one. Also, a safety alarm bracelet will be placed on your infant for security purposes and will sound if your infant gets near any entrance, exit, or elevator on the 3rd floor. Your nurse will be assessing you frequently after delivery during the recovery phase to check bleeding status, vital signs, your vaginal and rectal area for swelling, and the location of your uterus. The uterus will need to stay firm, and your nurse will massage this muscle frequently to prevent excess blood loss. Your nurse will also be applying ice and topical lidocaine. Your first 3 urine outputs will be measured to ensure your bladder is working correctly. Once you are stable, your nurse will assist you out of bed for the first time after delivery. For your safety, it is very important that you do not attempt to get out of bed without your nurse and support person both at the bedside.
My name's Shelby Harmon. I'm a registered nurse and certified breastfeeding counselor, and I've been working with CHRISTUS since 2015. As a mom myself, it was really important to me to feel confident in the decisions that I was making for myself and my newborn, especially in those first few days. So in my job, I just try really hard to listen to my moms and give them the tools they need to reach their goals. We do, of course, breastfeeding education with all of our moms that are interested in that. We also do the initial bath for all of our newborns in the room so that the parents get a good chance to really learn how to bathe their babies at home. We also help our parents to model safe sleep as well, because as new parents, of course, you're going to be exhausted. So it's important that you know how to safely lay your newborn down to sleep. I feel like I have my nursing knowledge and my knowledge as a mother to help our patients succeed and reach their goals.
Mother-baby unit. Approximately 3 to 4 hours after you deliver, you will be transferred to the mother-baby unit located directly behind the Center for New Life and remain there until discharge. Here, you will be assigned a mother-baby nurse who will provide specialized care for both you and your new little miracle. You may breastfeed on demand if you choose to, and all care will take place in your room. Pain management is provided based on your personal needs, physician orders, and upon request. Continuous modeling of self and newborn care at the bedside will empower you for independently caring for your baby at home. Your newborn will receive a bath within the first 24 hours after delivery and will receive the first of 3 hepatitis B vaccines, an antibiotic eye ointment, and a vitamin K shot to help with blood clotting. A hearing test and newborn lab work are done prior to hospital discharge. Circumcisions are an elective procedure that may be done before your hospital discharge, pending physician and insurance approval. If you deliver vaginally, you will stay 24 to 48 hours from time of delivery. If you have a cesarean section, you will stay 48 to 72 hours after the surgical delivery. You will be given detailed verbal and written discharge instructions from your nurse, so you will know what to do at home and when to follow up with your OB/GYN and newborn's pediatrician. All moms need to have a rear-facing infant car seat that has not expired. You may go to safercar.gov for expert car seat information and education. Newborns require a follow-up weight check and jaundice check 1 to 2 days after hospital discharge. Please make sure to have a pediatrician picked out for your infant. Call their office to ensure they accept your insurance and that they are taking new babies. You will need to make a follow-up appointment with your OB/GYN at 2 to 3 weeks and again at 6 weeks. Safe infant sleep practices will be demonstrated throughout your hospital stay. Safe sleep for your baby consists of following these simple steps called the ABCs of safe sleep. A. Alone. On their B. Back to sleep. In a C. Crib or pack and play or bassinet. Our hospital is one of only 5 pilot hospitals in the United States that has partnered with the National Action Partnership to promote safe sleep, to decrease sudden infant death syndrome and sudden unexpected infant death, as well as to support successful breastfeeding. Along with following the ABCs of safe sleep, families are taught the following additional safe sleep practices for home. 1. Keep soft blankets and pillows out of your newborn's crib or bassinet. 2. Have your baby sleep in a crib or bassinet next to your bed for 6 months. 3. Do not smoke or vape around your infant. 4. Do not overdress your baby. 1 extra layer than what you are wearing is enough to keep your baby warm. 5. Keep your home temperature 68 to 72 degrees Fahrenheit. 6. Once your baby is breastfeeding well, you may offer a pacifier at 3 to 4 weeks when putting your infant to sleep. 7. Always attend regular well visits with your infant's pediatrician and get your baby immunized.
My name is Lindsay Adams. I'm a registered nurse here at CHRISTUS. I've been a mother-baby nurse since 2015, and I'm also a certified breastfeeding counselor. So a lot of education is about safe sleep. We also teach on postpartum care and all of the different emotions and body changes and things that the moms are going to experience as well. It's this new baby they're bringing into the world that sometimes they've been waiting years on. So it can be a very emotional time for the parents as well as the nurse, because when you're here for 3 days, you kind of feel like you become part of the family. So it's just an experience that you're so grateful to be a part of, to help these new moms to learn what their new role is as a mom and to meet their expectations. And we want to build trust with our moms. We want them to be able to feel confident. So I always start out with my new moms and tell them, hey, there is no stupid question. There are lots of things that I learn as a mom every day. I've been a mom for 16 years and I'm still learning. So as a mom, I try to use some of the experience that I had with all 3 of my kids. Their births, they're all different. They have different personalities. So everything is going to be different with each child. And I just try to use that to help these new moms.
Neonatal Intensive Care Unit. While most infants are born healthy and room in with mom, Some infants require intensive care and are unexpectedly admitted to the Neonatal Intensive Care Unit, or NICU. Our spiritual care staff will provide support for you and your support person throughout this time of uncertainty. Some common reasons for NICU admission include: your newborn is delivered early, preterm delivery less than 37 weeks, has breathing difficulties, heart conditions, feeding problems, or other health concerns. You and your support person will be allowed to visit your infant in the NICU. Your infant's neonatologist, neonatal nurse practitioners, nurses, and lactation consultants will keep you updated and give you a plan of care. Hospital-grade breast pumps are available for breastfeeding moms that need to pump while separated from their infant in the NICU. Providing even a few drops of your first milk works like medicine to protect your infant's immune system. You may begin holding your baby skin to skin and breastfeeding in the NICU once your infant is deemed stable per the neonatologist and/or neonatal nurse practitioner. The length of stay for your infant in the NICU may range from a few days to several months, depending on your infant's individual health condition.
Hello, my name is Elisa Gabbett. I'm a registered nurse in the neonatal ICU. I have my certification in low-risk neonatal nursing as well as certification in breastfeeding counselor. Our neonatal ICU composed of a team of doctors, nurse practitioners, nurses, respiratory therapists, and lactation consultants. And we are always ready to take care of any sick baby that comes through our unit. Once the baby is born, we invite the daddy or the significant other to walk in the neonatal ICU with us. And we encourage them to be here and visiting their baby all the time or as much as they can. The nurses are always at the bedside taking care of the baby. The nurse practitioner, the doctor, the respiratory therapist, and the lactation consultants are also available. We just have to call them and they are there right away. Your baby's in the best hands and the best care here at St. Elizabeth.
We have 4 lactation consultants and over 60 certified breastfeeding counselors that will assist you with breastfeeding throughout your hospital stay. We will encourage you to breastfeed 8 or more times in 24 hours following your infant's hunger cues. Your infant will also need to feed at least 1 to 2 times during the night. Most infants will feed frequently during the night for the first several weeks of life. This is normal and helps bring in your milk supply. Do not schedule your breastfeeding. Instead, watch your infant's hunger cues. Opening mouth, sucking movements, or turning toward your breast. You will learn your baby's hunger signs after rooming in for a few days. It is best to do skin to skin with each breastfeeding early on to promote bonding and to increase your milk supply. Deep latch technique, proper positioning, and tracking your baby's feedings and output are taught and reinforced throughout your hospital stay. Whether you want to breastfeed for 1 day or 3 years, we are here to support your individual goals. You may bring your own breastfeeding gowns and bras from home, and many moms bring along a boppy or breastfeeding pillow to assist with comfortable positioning. You will receive lactation handouts and an intake and output log to assist you along the way. Always remember to call for assistance with latching or any lactation questions that may arise. Our Mother-Baby Clinic provides ongoing hands-on lactation support for you and your baby after hospital discharge. Many mothers need additional latch assistance, support with positioning, feeding assessments, and nipple assessments to ensure breastfeeding starts off well and continues for as long as mom wishes to breastfeed. If you and your infant want to follow up in our outpatient mother-baby clinic, please have your OBGYN or pediatrician send a referral. Once we receive your physician referral, we will schedule your appointment in the clinic at your convenience. Our mother-baby clinic has now expanded services to include follow-up weight checks, jaundice checks, circumcision, tongue tie revisions, and other outpatient procedures. C-section. While our hope for you is to have a routine vaginal delivery, a cesarean section may be deemed medically necessary. If you know ahead of time that you will be having a cesarean section, or if you are having a repeat C-section, your OBGYN's office will schedule your procedure and explain the steps. Whenever the C-section is unexpected, our goal is to explain every step along the way in preparing for your surgical delivery. You will be in excellent hands, and your pain will be managed appropriately so you can enjoy the birth of your baby. One support person may accompany you during the preoperative procedures, during the C-section, and immediately afterwards in the recovery room. The OBGYN recovery room is where you will stay approximately 1 to 2 hours after your C-section. Breastfeeding and skin-to-skin may begin as soon as possible after delivery with assistance from your nurse. Immediate maternal recovery care will include vital signs, bleeding and incision assessment, massaging of the uterus, and pain management. 2 to 3 hours after the cesarean section, you will be transferred via a stretcher to the mother-baby unit for ongoing care and will remain there until hospital discharge.
My name is Morgan Greenway. I'm a registered nurse and also a certified breastfeeding counselor. I've been with CHRISTUS St. Elizabeth since 2017. In OB-GYN surgery, no day is the same. We could have 1 scheduled C-section, or we could have 6 scheduled C-sections with additional 4 urgent emergency C-sections as well. You know, unfortunately, C-sections are looked down upon, and if it's medically necessary, we need to get baby out as safely as possible. So after baby is born, mom is able to do skin-to-skin in the OR, and after that's done, the baby and support person will go into recovery. Mom will follow not too long behind, and mom will meet the support person and baby into recovery. Mom is then able to do skin-to-skin, breastfeed, and bond with her baby. I just had a baby 4 months ago, so there is no other feeling than meeting your baby for the first time. And so to see that on a daily basis, there's no experience like it. We know that it is nerve-wracking, but you are in the best hands, and that we will provide the best care possible.
My name is Courtney Adkins. I am a registered nurse here at St. Elizabeth. I have been here since 2015. I'm also a certified breastfeeding counselor. So we are in OB-GYN surgery. We pre-op, circulate, and recover our own patients back here with our C-sections. We love our jobs here, and I love bonding with my patients. I like to get to know them in pre-op and stay with them the whole time. So it's pretty cool to be with them the whole time, have that experience with them. I also like to take pictures for the moms and try to have the best experience they can possibly have. As a new mom, I think it's very important right when you meet your nurse to form a bond with them. You're going through a lot, it's scary, you're having surgery, so we're here to help y'all feel better. We try to walk our moms through every step. I don't like surprises, I'm not trying to scare anybody, so I let them know right when I meet them what's gonna happen. I walk them through the whole process, I hold them with the spinal, I'm there with them in surgery, I'm there with them in recovery, and I just want them to have the best experience. If you do have to come have a C-section at St. Elizabeth, you will be in the best hands because we truly do love our jobs and we love our moms and our babies, so you will be in the best hands here at St. Elizabeth.
Discharged home. Once you are discharged home, please have a support person stay and assist you for the first several days. Do not lift anything heavier than your baby and do not drive for 2 to 4 weeks. Report to your provider if you experience excessive vaginal bleeding or if you soak through 1 pad in an hour or less, signs of postpartum depression, increased uterine pain, pain or burning with urination, foul vaginal discharge, fever greater than 100.4 degrees Fahrenheit, redness or streaking around incision, lumps, redness, or pain in your breast. More than 10% of new moms experience postpartum mood and anxiety disorders. This may occur suddenly after birth or gradually over the year following your delivery. Please notify your OBGYN if you experience excessive anxiety, irritability, crying or sadness that does not go away, inability to sleep, difficulty concentrating, inability to care for yourself and baby, thoughts of harming yourself or baby. Postpartum depression is caused by a chemical imbalance and can be treated with therapy and medications deemed medically necessary by your provider.
Hi, I'm Amanda Goss. I'm a registered nurse here at St. Elizabeth. I've been here since 1999. I started out as a labor and delivery nurse for about 14 years, and I've worked as an international board certified lactation consultant since 2015. I am also one of the prenatal educators, and you will see me in some of the live Zoom classes. I work as a lactation consultant on the floor here at St. Elizabeth. I help moms breastfeed their babies on the floor, and I also help in the mother-baby clinic for follow-up care. Since we spend so much time here at the hospital, we really try to do the best we can to help our moms and babies, but sometimes they need more ongoing care. They can come and follow back up with us in our outpatient lactation clinic, which is our mother-baby clinic, and get ongoing breastfeeding assistance.
Hi, I'm Stacy LeBlanc. I'm the lead lactation consultant here at St. Elizabeth. I started off in the neonatal ICU in 1996, and I've been in lactation for the last 13 years. Our team established our mother-baby clinic because there are a lot of moms that go home still needing additional help. As a tenured nurse in NICU, I saw a lot of moms struggling in the first few days of breastfeeding. And so it is so important to me as a nurse and a lactation consultant to be able to help these moms, help our community, and help our families reach their breastfeeding goals, whatever they may be. So now moms can come back for hands-on assistance with latching on their babies, just questions. A lot of moms need some reassurance just by weighing their babies after they feed to see how much their babies are getting from the breast. So we want to establish a sense of security and confidence, and so our mother-baby clinic allows us to do that. It's super important for our families to educate yourself and have a plan when you walk in the door of what you want your birth experience to be like. Then inform your staff, let your nurses know, and communicate what you would like, what you need, and we will do everything in our power to make sure that comes to pass.
Why do I need to establish a pediatric provider before my baby is born? 1. Your newborn will need to have their first follow-up within 2 to 3 days of discharge. Potential common problems for newborns include feeding issues, weight loss, and/or jaundice. Having an established pediatric provider will make this process easier and prevents delay in care. 2. Some pediatric providers require pre-registration and approval before they will schedule an appointment for your baby. 3. To confirm the pediatric provider you have chosen is accepting new patients. 4. To confirm the pediatric provider you have chosen accepts your insurance. 5. If you plan to delay or opt out of the recommended vaccine schedule, your options for a pediatric provider will be limited. Most pediatric providers follow the current vaccination schedule, which is endorsed by American Academy of Pediatrics, AAP, American College of Obstetricians and Gynecologists, ACOG, American Academy of Family Physicians, AAFP, Centers for Disease Control and Prevention, CDC, and World Health Organization, WHO, or WHO. Closing. Please refer to the Enjoy Health link for detailed medical information and education, along with more than 50 videos you may watch at your leisure. Thank you for choosing CHRISTUS St. Elizabeth to provide you and your baby with the best start possible. We look forward to meeting and caring for you and your sweet new blessing.